Neighborhood Health Watch is sponsored by the doctors of HCA Virginia Health System.
The topic today in Neighborhood Health Watch, the signs of stroke and treatment options. A stroke is a medical emergency and immediate medical help is crucial to a person's recovery and survival. Early action can reduce the damage a stroke causes to the brain and potential complications. The promising news is that strokes can be treated and prevented. And here to get us informed is Dr. Alan Schulman with Henrico Doctors Hospital. Thanks a lot for joining us for First at 4. We appreciate it.
Thank you.
You know, there is good news to report. Fewer people die of stroke than in the past. What's going on? What are people doing differently? What are doctors doing differently?
I think there are several reasons for that. One is that there is some more recognition by patients and family of the signs of a stroke. We do have more and more stroke units or specialized neurology units. They take care of people once they're at the hospital. We're treating people more with treatments, including a medication we've had for a long time, IV Tpa, a clotbuster drug, but we're giving it much more than we did even 5 or 10 years ago. And we have some other procedures that are helping as well.
Okay, what causes stroke and what's going on in the body when you're having a stroke?
So most strokes are a clot in the blood vessel in the brain that cause a lack of oxygen and other nutrients to the brain and cause injury to the brain. A much smaller amount of strokes are bleeding strokes to the brain, which are ruptures of blood vessels for a variety of reasons. But the majority are clot strokes.
And you know, talk a little bit more about those two treatment options that I know you want our viewers to know about.
Right.
And IV Tpa and mechanical thrombectomy.
Right.
Talk about those.
Sure. So we've had IV Tpa, which is a clotbuster drug, which helps dissolve clots in the brain during a stroke. We've had that for over 20 years, but like I said, we're using it much more. In many people, we can use it up to 4.5 hours, but the earlier that we treat people, often the better that they do. We've also had a procedure called mechanical thrombectomy for many years, but we're using that much more, and that's when a doctor inserts a catheter into the groin, goes all the way up to the brain, and helps remove the clot by various means. Up until recently, we were only using that within 6 hours of a stroke, but recent studies just in the past year or two have shown that selected patients up to 24 hours with large vessel clots might benefit from that procedure.
That's awesome. And very quickly, what are the main symptoms of stroke, and are they different from women?
Well, women often have the same as men. Some of the most common ones are in the acronym FAST, so F-A-S-T. F stands for facial droop, A stands for arm weakness, and S for speech disturbance. So those are among the most common symptoms of a stroke. And T stands for time, meaning time is of the essence of getting somebody to medical treatment and treating.
Right. Act quickly. Dr. Schulman,
right.
Thank you so much for joining us. We appreciate it. We'll have to have you back.